Good afternoon, everyone. Welcome to the first Recovery Support Services Echo and our new platform, iEcho. It's nice to see that all of you were able to join us through this new platform. And as you navigate through this portal, you're going to find out that there are several advantages and features that you are going to benefit from in this new portal. So thank you again for being here. We'll talk a little bit more about Echo in the future. For now, welcome again to the session. And I want to remind you first off that this session is being recorded for later distribution. However, the information that you see on the chat will not appear on the recording. We invite you to identify yourselves on the chat by adding your names, email addresses, and affiliations. That way we can keep records of your attendance to this class. But if you're joining via phone, you can always send an email at bultexas@utesca.edu. If you need captionings for the sessions, you may navigate to the bottom part of your Zoom windows and click on the navigation feature. And in this 1-hour training session, we're going to start with a didactic presentation by Dr. Hernandez, followed by your questions. After that, we're moving to a case presentation. And this is one of you, actually, one of our members of the community of learners who presents a case for us to give them some feedback. So we invite you in this part of the class to offer your perspectives and your views on the case. We want to hear your voices. Remember that these echo sessions are made for you, the learners. One little thing we ask from you, if you could please raise your hands and wait until we call your names before you unmute your microphones. And this is just to ensure that we have a conversation in which all of us have the same opportunity to participate and express our views. But besides that, the sessions are for you and we want to hear your voices. So we're going to start with some introductions from the Recovery Support Services Hub of Experts. Susie Walker, welcome to the session. Do you want to introduce yourself?
Thank you. Hello, everyone. My name is Susie Walker. I'm a woman in long-term recovery, and I am the executive director for the Recovery Partners of Vermont, and I'm glad to be here.
Thank you, Susie. Our case presenter of the day, Samantha.
Hi, my name is Samantha. I am a recovery coach at Helen Farabee Centers. I am a woman in recovery, and thank you for having me today.
Well, thank you for presenting a case for us. Welcome to the session. Jasmine Vidal.
Hello, everyone. My name is Jasmine Vidal, and I'm the Echo Coordinator for our RSS Echo. Thank you for joining us, and I hope you enjoyed today's session.
Thank you, Jasmine. And now we're going to our speaker of the day, Dr. Hannah Hernandez. Dr. Hernandez, if you're ready, we can start sharing your didactics. And also, if you can briefly introduce yourself to the group. Thank you.
Thank you and welcome everybody. Happy New Year. Felicidades en el año nuevo. My name is Hernandez. And just to tell you a little bit about myself, I've worked in the field of health and human services with a specific focus on mental health and substance use disorders for the last 37 years and about a month now. I worked in inpatient settings, outpatient settings. I work across the continuum from prevention to intervention to the multiple pathways of recovery to recovery supports. I have a certification and license as an addictions counselor, as you can see from the many letters after my name, and I have a PhD. I also have a GED, and my GED I earned in prison, and it was more difficult to earn a GED in prison than a PhD out here. I'm a person in long-term recovery, which for me means that I haven't used a drug, including alcohol, for the last 38 years and 1 month. That enables me to be a productive member of my familia, first and foremost, and to be present with you today. Thank you for joining once again. I'm going to begin the presentation, take no more than 15 minutes. Then we have about 5 minutes allocated for some questions. So please feel free to be thinking about your questions as I go through the presentation, which is all about understanding and supporting the stages of recovery, right? We know that there are differences in the stages and how people get better and how people engage recovery processes. So there's some disclosures here to give you right off the top, right? All the speakers and members of the planning committee have no relevant financial relationships or commercial interest to disclose here. And the views and opinions expressed by the participants and speakers attending this ECHO session are solely their opinions or our opinions and do not reflect the official position of UT Health San Antonio. So those are the disclosures. The objective for today is to define recovery and the multiple pathways of recovery, to define the stages of recovery, to articulate 3 or 4 strategies in supporting people along the recovery continuum. We want to make sure that we are connecting this conversation to the case study that's going to be presented a little bit later on. So we want you to have all of this stuff in mind as we go through this, right? So let's begin with this ground setting with a definition of recovery. This comes to us by way of SAMHSA. In terms of the definition, the Substance Abuse and Mental Health Services Administration at the federal level, but know that this definition was developed by people like us who work in the field, just convened by SAMHSA, right? Recovery is a process of change through which individuals improve their health and wellness. They live a self-directed life and strive to reach their full potential, right? So there are some key things here right after RIP. Improve their health and wellness, live a self-directed life, and reach their full potential, whatever that is. It's relative to different people in different ways. We understand that there are 4 dimensions of recovery, and here they are, right? Health. So when we think of health, we're talking about living in a physically and emotionally healthy way, as well as overcoming or managing one diseases or symptoms, right? And we're not just talking about physical health, we're talking about psychological health, spiritual health, we're talking about financial health, we're talking about many, many, many different things as it relates to health, right? The next piece is home, right? So we're talking about a safe, stable, recovery conducive place to live, which is critical for all of us in today's society. And then purpose. This is something that we see come across for people who enter recovery processes. They talk about things about, I want to give back. And so when you think about people saying that, it provides an opportunity to work with people on developing purpose. These are meaningful daily activities such as a job, going to school, volunteering in different places, taking care of family, other creative endeavors, and it requires independence, income, and resources to participate in society. So we can all already see that this requires resources from top to bottom. And then community, relationships, and social networks that provide support, friendship, love, and hope. I belong to the recovery community. I also belong to the Latino community. I belong to a professional community. I belong to a number of other communities that have been made possible because of my embracing recovery and doing that. We wanted to also present you with a different recovery definition, and this one by William White. William White is if not the leading research on all things recovery in the United States. If you Google William White papers, it'll take you to a whole bunch of resources that are there. And he defines it as the experience of a meaningful, productive life within the limits imposed by the risks of addiction. Recovery is both acceptance and transcendence of limitation. It is the achievement of optimal health, the process of rising above and becoming more than an illness. Recovery, in contrast to treatment, is both done and defined by the person in recovery. I want to pull some things here apart before we move forward in the presentation. If you notice from the previous slide, this doesn't mention addiction, it doesn't mention drugs, it doesn't mention mental health, it doesn't mention any of that. It focuses on issues of recovery. William White, different from that definition, and I'm not saying that one is better than the other. You get to choose that for yourself. But he says recovery is both acceptance and transcendence of limitation, meaning that there are some limitations from a life of using substances and that sort of thing, but we can transcend some of those limitations, some, but not all, right? It's the achievement of optimal health. And this piece here is critical. The process of rising above and becoming more than an illness. For the resource team that presented ourselves today, we didn't say we're addicts. We said we are people in recovery, right? Why? Because we are more than just an illness, right? And we don't want to feed stigma and that sort of thing. This is William White asking us not to go around calling people addicts and frequent flyers and schizophrenics and bipolar. And essentially, he's telling us we should not um, uh, pathologize people who are in need of humanization, right? And then this last piece is really important. Recovery, in contrast to treatment, is both defined and done by the person in recovery. Let's hang on to that statement as I come to the next slide. And here we center SAMHSA's working definition of recovery in this wheel, right? So it's person-driven, it's the multiple pathways of recovery, it's holistic, it's peer support, it's relational, it has to include issues of culture, it addresses trauma, it leads with strengths and responsibilities and respect and hope, right? So it's very much forward-looking. Now, in the two definitions, there, I want to draw attention to the multiple pathways of recovery. There's no one way of doing things. And in previous ECHO sessions, these have been discussed. But I just want to make sure that we are on the same page. Not everybody needs to go to any one particular pathway of recovery that I'm familiar with. In other words, we should allow for people choice and self-determination and agency. So we should work towards putting options in front of people and have them select what's best for them. We know if we've learned something over the last several decades is that when we impose our will, our way of thinking, our way of doing things on people, it just doesn't work. It doesn't work at all. Think about a moment in time that you needed to change something about yourself. Did that change came about because someone imposed it on you or because you chose it? Because you had the opportunity to think about what that change is, and then you got the supports to be able to do it, right? When it's imposed on people, it's less likely to work. And what our field has done really well is to blame people for failures after we imposed a solution on them. So again, choice, self-determination, and agency is extremely important. Think about when you go to a restaurant. They don't say you're having hot dogs whether you like it or not. They come with a menu, right? And you get to choose from that menu. And if you like it, you have more of it. And if you don't like it, you choose something else, right? And that sounds like a simple concept, but that is where we're going by way of agency, self-determination, all of that. So moving forward, we need to think about the stages of recovery, right? And Kurtz and White, William White very specifically, have done a lot of work in this area. And there's some resources at the end that you can look at. So this continuum, if you will, is recovery, pre-recovery or pre-recovery, recovery initiation, early recovery, and long-term recovery. I'm going to cover those rather quickly and then enter into some conversation with you. So when we're thinking about recovery, let's think about the folks who are in active substance use. They might have, by the way, some co-occurring health issues, some co-occurring mental health issues as well. But they're in active substance use, right? Pre-recovery. The stage, in terms of stages of change, they are anywhere from pre-contemplation to contemplation, right? Because people go back and forth between these stages. But pre-contemplation is I'm not interested, I'm not ready, I'm not even knowledgeable. And contemplation is I'm beginning to think about it or I'm thinking about it, right? They are very much experiencing the negative consequences from that substance use, from living on the street, from whatever it is that they're doing that brings them negative consequences to family, as it relates to relationships, as it relates to work, as it relates to financial matters, right? All of those things. The focus here should be on us doing education to raise awareness of the severity of the problem so that they can move from pre-contemplation to contemplation and then to preparation. The focus should not be beating people over the head with, you need to go to treatment, you need to go to treatment, because again, that's us imposing our will on people. And we need to be stage specific. If someone is in pre-contemplation, then the messaging is a little bit different. And it has to do with education and utilizing tools like motivational interviewing to engage people in conversations so that they can begin to see where they are and make some decisions of where they want to be in the future. Because they're actively using, we have to focus on harm reduction. We have to. I believe that. Here's why. Dead people don't recover. And because I tell people drugs are bad, that doesn't mean that they're going to stop using them. Drugs have been around for millennia, and alcohol too, right? And just telling people to stop is not the solution. So if you're going to use safely, right? And we put resources in front of people that helps them to make healthier decisions. That's in the area of change that we want to go to, and we want to continue to provide ongoing supports, right? So the needs here, what are the needs? Many have needs for health, for home, right? Those are the recovery domains that we talked about earlier, purpose and community, right? And so we need to figure out what those needs are from them and begin to help work with them to meet those needs. When we begin to work with them on meeting those needs, along the way, they'll start thinking about stopping to use. So stopping to use should not be used as, that's the thing that you need to do before you can get anything else. Because that has proven to be not true for folk. So that's pre-recovery, right? Well, William White and Kurtz define as pre-recovery. Moving on to recovery initiation. Now, this is the initiation of recovery. So what stage of change are we talking about here? We are talking about anywhere from contemplation. Now there's not this piece of, I'm not interested in doing anything, I'm contemplating doing something, all the way to the planification, so preparation. That's the stage that people are in, right? There's development of behavioral intent. In other words, I am choosing to do something about this, right? So that has to be present in order for the person to be in this recovery initiation phase. There's an identification, or the beginning of the identification and a plan that includes goals and objectives and those sorts of things, right? And this is where we can be really helpful with people as clinical people, but also working with non-clinical people, including recovery coaches and mentors and all sorts of people that can be in this process. And there's identification of needed resources. So recovery capital is what we call this, right? Internal recovery capital, external recovery capital, which includes housing, healthcare, the ability to say no, advocate for oneself. All of those things are considered recovery capital. And we need to be able to identify those for what reason? To be able to work with people in obtaining them. And there's identification of an initiation in recovery pathway or pathways of their choosing. So someone can say, I want to go to 12-step and I want to go to the gym. Someone says, I want to go to church and I want to do smart recovery. Someone says, I want to do residential. And someone else says, I want to do outpatient and I want to go to the gym. Whatever those things are, there needs to be identification of what those things are. And our role is to do what? To be a cheerleader, to support, to help identify barriers and remove those barriers, and to support people with recovery resources, right? And then there's to initiate connection with the recovery community. Remember that domain, community, right? Many people who stop using, who are currently using drugs, they don't have connection with the recovery community. So we need to introduce opportunities for people to engage with the recovery community, right? And it's not about being independent. It's about being interdependent, right? And that's what the recovery community provides, an opportunity for connection, right? The needs here, again, are health, home, purpose, community, those recovery domains. And we need to figure out what people need. Some people already have housing, but some people don't. Some people already have healthcare, but don't have a primary care provider. Some people haven't been to the dentist in 20 years. Whatever those things are, we work with people in those things, right? So that's recovery initiation. There's something called short-term recovery. Here we're talking about 5 years or less. Now, 5 years is a long time, but it's still considered, according to the research, short-term recovery. The stage of change here, or stages, is anywhere between action and maintenance, right? Maintenance is 6 months or more, 6 months or more performing whatever that behavioral change is. So if they're more than 6 months, they're in maintenance. If they're less than 6 months, they're probably in action. They have clear goals and a plan because they're in this stage, right? They're not just thinking about it when they were in the beginning. They have some clear goals. Doesn't mean that they have it all figured out. They're engaged in the recovery pathway, right? They're fully engaged in that recovery pathway or pathways, more than one, whatever those are. Again, of their choosing. Remember, self-determination, agency, choice is critical here. And they're engaged with the recovery community. If those are mentors, sponsors, some people rely on faith advisors, those sorts of things, and we can measure their level of recovery capital. Do they have a home? Do they have a job? Do they have a primary care provider? Do they have health insurance? Are they seeing a dentist? Are they seeing someone for their mental health? We can measure their recovery capital, right? And we can also measure internal recovery capital, their ability to advocate for themselves, to develop relationships, their self-esteem, those sorts of things are all internal portions of recovery capital. And again, the needs here, we'll repeat these over and over and over again because they come directly from the domains: home, health, purpose, community, right? All of those things are important, not just to people in recovery. Those are important to all of us, to all of us. Every single human being deserves and requires these to be healthy. And here's the final piece on long-term recovery. This is 5 years or more. Now here, because it's time sensitive, we're talking about more than 6 months. These folks are in the maintenance stage, right? Of what Prochaska and Di Clemente called stages of change, or the trans-theoretical model. They are continuing their goals and adding new ones, right? So I'm in long-term recovery. I have no need for housing because I have a house. I have a primary care provider. My goals right now, because I'm the age that I am planning for retirement. You see that that's different, right? I don't need initiation in connection with my family. I did that a very long time ago, and I'm really engaged with my family. You see, so there's continued goals and there's new ones that people add, including for some people, it's like, I want to go back to school. I want to get a degree. I want to be trained in this. I want this type of job. I want to move here. My kids, whatever those things are. Um, Continued engagement with recovery pathways is for sure central to this, and engage with the recovery community. Again, there's continued engagement here. Some people change whatever that engagement is over time. So some people have, take for example, people who go to groups: Smart Recovery, Rational Recovery, 12-step, whatever the groups of their choosing, faith-based, Celebrate Recovery. They used to go every week. As a matter of fact, they went twice a day because they needed it in the beginning. And now they're in long-term recovery. They're not going, twice a day or twice a week. Maybe they're going to their home group once a week. Whatever that is, it changes for them, right? And we just need to be aware of that and supportive of what those things are and what they look like. There's measurable recovery capital. Again, we're talking long-term recovery, right? So there's measurable recovery capital there. And then the needs are there. They're not in the same way, right? Because I still have the need to have my house, which is recovery conducive and a safe place to live, right? Purpose, I work on that every day. That's why I get up and do what I do, right? Community, I told you that I'm connected to community in many different ways. So this stage, by way of long-term recovery, we in terms of some takeaways to say here right after Rip, right? Agency, choice, and self-determination, to assess people in what stage of readiness they're in. Those things become extremely important. Let me stop there. You'll see the references there that you can go to, that you'll get a copy of, and you have my contact information there. What I'm going to do now is I'm going to take down the slides because I think it's easier for us to see each other, and not be staring at slides, and open it up for some question, comment, discussion. And feel free to raise your virtual hand and we can call on you. Go ahead, Laura. Please come in.
Hi, so I just have a question. This is my first time being in a peer recovery coach role, and I just had a question in the sense of like it's more about meeting the client where they are, right? So even if they're in active use, my goal isn't necessarily to help them stop using, it's to help them with their life to be less unmanageable. Like if they were like, oh, I don't want to shoot heroin anymore, but I'm still going to smoke weed, it's beneficial to help meet them where they're at, like to be as safe as possible, right?
Laura, thank you very much for centering that. That's about choice, agency, self-determination, but leading with respect and
Mm,
understanding, right? So, I'm working with someone now who said, I'm doing 10 bags of heroin a day, which is fentanyl, right? And he says,
mm,
I want to cut back. I want to cut back. I said, how many? He says, I want to cut back to 5. Great, that's a goal, right? And I should be able to support that because
right.
there is behavior change in that, right?
Mm,
Whatever it is that the person wants to do that's for the better, that's why I included the harm reduction piece because we are talking about harm reduction
mm,
and we are talking about meeting people where they're at. Now, people say that and they think that it's physically. Yes, it's physically, but it's also psychologically, emotionally, spiritually, right? To meet people where they're at and to allow them to make decisions for themselves. And we use the tools that we have, motivational interviewing, stages of change, all of those resources to be able to ascertain that and help people move along the change continuum. So you're right. You're 100% right. This is not my agenda. Let me self-disclose something to you right now. When I started to do this work, um, 30 something, almost 40 years ago, I was hired as an outreach worker. I didn't know what an outreach worker was, but I took on the job because they believed in me more than what I believed in myself.
mm,
And they said, your job is to go out there and find people who want to get into, we didn't call it recovery back then, but find people who need treatment. And so I thought that everybody needed what I got because my recovery pathway was the best. And I needed to impose that on everybody. So Samantha needed a TC, Jasmine needed a TC, Laura, you needed a TC. Everybody that I came in contact with in a TC is a therapeutic community because that's what I got. You know how many mistakes I made with that? Now, I had good mentors who mentored me off that ledge and said, no, some people will go to 12 steps, some people will go here, some people will continue using. I don't want people to get infected with HIV or hepatitis C. So, meeting people where they're at, as Laura very well states, there's a lot of things that we can do with people, even people who don't want to stop using. They can
mm,
use safer,
mm.
right? They can use safer. Now, there will be some people say, I'm done, I'm tired, I'm ready to stop. The steps there look a little bit different, right? From
Yeah.
detox, if that's what they need, to whatever other pathway they're choosing. Thank you for that, Laura. I hope my response was in line with your experience on the ground.
Yes, of course. Thank you so much.
Mhm. There was a question in the chat or a comment and a question about being a lot of information condensed into a few minutes. Yeah, that's the time constraint that we have. But the slides are available, right? And there's resources that are available to continue to support your growth and learning from these issue areas here. Anybody else with a comment, a question, anything you might want to contribute to this portion of it?
I just want to say thank you for breaking down the connection from the stages of change to the recovery stages. I've heard you before. Love the way you break things down. Appreciate it.
Thank you, Cynthia. And we draw from that research, right? Because when we do motivational interviewing, stages of change is in it. When we do, right, stages of change, that draws upon other behavioral health change models that are out there that people use. And when we draw on lived and living experience, right, that elevates the conversation as well and validates people's experiences. And for me, you don't have to have the lived experience to be able to help people. But if you do, think about how you use that. Richard, please come in, sir.
Yes, real quick. I just wanted to say I saw a question here and I thought it was just really Kristen, when she talked about how can we change the perception that we don't have abstinence in recovery, and that's not in our terms, right? But more importantly, among family members, I think being able to convince family members are the one group that when I'm working with someone that really pushes, that has a lack of understanding of where that individual may be. And and they are the ones who want abstinence or sobriety for the person, and not necessarily just okay with progressive behavioral changes. How can we address the family members in a way that they can better understand this concept?
Well, thank you for picking that up, Richard, and for your comments and contribution here. I'm going to say a few things. We know a great deal because we've studied it around family systems theory, right? And some family members and some families within some certain family units, when there's a person with the identified problem, they begin to think that that's the person with the problem. We understand from family systems theory is that that person needs help, but the entire family needs help, right? And so the more that we can engage with family early on becomes really important. Within my family, I had to engage certain people within my family, within my counseling process, so that they can better understand. Some families go to Al Anon, Alateen, whatever those things are for them. Some people find support within clergy or within systems of faith for the family. And so it's important that we engage family as much as possible, that we engage the right family members in the process, that we attend to issues of confidentiality, right? All of those things, and that we educate family, because a lot of what we're talking about is a lack of information, right? You think about it. Some people think that, your problem with drugs is that you lack willpower. And in my community, the Latino community, has to do with maybe some evil spirits that are, lurking around that drove you to this. And so a lot of education, a lot of support, and be careful because there are, in family systems theory, there are different roles that people play within the family. And when you start dealing with these things, you need people who are well educated in family system theory and family therapy, if that's what you're doing. Um, so I encourage each and every one of us to get some training around family system theory and to engage with families. Thank you for that. Lindsay, please unmute yourself and come in.
Yeah, so I just wanted to, you know, kind of say that it's one of the things I see very often, right, is that we want people to get into this community, and we have this idea. We understand now that the recovery doesn't equal abstinence, but you see a lot of like sober events, right? And everything seems to be, oh, this is a sober event. Well, I caution people to look at that and really look at like the language around that, right? Because if it's okay if somebody's not abstinent, then, and we want them to have a community too, we need to open up those types of events and the way that we talk about those events.
One of the really good things is that these conversations are taking place across the country. There's a lot of people engaged in understanding what mistakes we've made in the past and what we need to do moving forward. I'm a public health person. I believe in multiple strategies over multiple domains. I believe in the multiple pathways of recovery, whatever that means to different people. Some people don't even identify with the term recovery, and I'm okay with that. Let's lead with wellness. Whatever it is that's helping you to get better, whatever that is what it is. I'm not going to impose my view on folk, and these different activities, whether they're called sober events or other, types of hybrids that are out there. The more the merrier, as far as I'm concerned. We need to create community, right? And part of the domain was on that, on community. So what does community look like? People seeking, needing, or in recovery don't live in silos. We live in connection with other people, right? And in other communities. I remember, um, you know, when I was coming into this recovery process, people say, "Oh, you can't hang out with people who use drugs." And I said, "Well, there goes half of my family. What are you talking about?" Right? It is relative. We need to be careful not to paint with broad brushes because it's not one size fits all. Andrea, please come in. I see your hand. I'm thinking we're up for time, right?
Yes, thank you so much. I just want to say that you have some incredible accolades here on the chat. People are really loving your presentation. And yes, I want to remind everybody that if you're really interested in the topic, for sure, we can have a second part of the same topic. Our sessions are only 1 hour, but again, we can have Dr. Henner talking about this in the future again. And in the meantime, if that is okay, you may start adding your questions to the chat while we move to announcements. And thank you, Dr. Hernandez, again. We'll go back to this didactic as we revisit the case later. Thank you,
Muchas
Anthony.
gracias, and thank you for all the comments in the chat. Muchas gracias.
You're welcome. So the Center for Substance Use Training and Telementoring, CSTAT, offers technical assistance for a wide range of needs. If you're interested in technical assistance, just go to our website, cstat.utesca.edu. There is a TA form there, and once you complete that form, you should expect approximately 3 days until someone from our team will get back to you. Thank you. Next. And if you're interested in receiving your certificates today, please make sure that you answer our post-session survey. We're sharing it with you right now on the chat, and it will also be sent with the material that we're discussing today in an email after this session. When you see the questions, are you applying for CEUs today? Please answer yes. And it will take approximately 2 or 3 weeks for you to receive your certificates via email. Next. And we want to remind you that we will not have a recovery support services echo in February because all of us and all of you, we will be in El Paso, Texas at our Texas Substance Use Symposium. So we wanted to cancel the session to give all of you the opportunity to attend this 2-day amazing sessions. This is a great opportunity to network with other people in the field and to gain incredible knowledge and insight in everything related to substance use disorders. Next. And if you want to register for the Texas Substance Use Symposium, what you have to do is go to our webpage, that is txsus.org. And remember, it's in El Paso, Texas. You can register in person or virtually, and that's February 27 and 28. So we'll see you there. Next. And we know that some of you are interested in being sponsors or exhibitors, and we're thrilled about that. We still have a variety of sponsorship and exhibitor packages available according to your needs, what you prefer. If you want to be our sponsor or exhibitor, please go to our webpage, that is texas.org/sponsor Texas. We'll be more than happy to have you sponsoring or simply being an exhibitor at our conference. Next. And now we're moving to our case discussion, and I'm going to invite Samantha. Whenever you're ready, we're going to start sharing the case presentation. And Samantha, if you can really briefly walk us through the case, please.
Okay. My name is Samantha. I'm a peer support specialist, and so my case presentation is over one of my clients. She is currently involved with CPS, and her children have currently been removed for both testing positive as well as herself. She reported in the beginning of her case that her spouse had been abusive to her, and she when CPS asked her to move him out of the situation, she became very started to deny the domestic abuse, and she states that he don't live with her, and she has called me in the past, and he would be telling her what to say, and what, she would put me on mute so he could tell her what to say. And it's a situation I don't know how to bring to light, that the situation she is in is going to cause her to lose her kids, and how to be aware of what she's going through and how it's negatively impacting her. And CPS currently wants her to go to a domestic violence program, and she kind of refuses to go. And they very bluntly told her that, if you don't go to first step, we're gonna move forward with removing your kids from you. And, I don't think she's acknowledging the situation she's in. She thinks that she can just, like, I don't know, deny her way out of this situation, maybe. She states that she's been clean, but CPS says that she's had multiple tests where she's failed for alcohol and cocaine, and they don't think that she's taking anything serious at all. So I really don't know. I feel like I'm at a loss with her on how to help her, and, you know, the understanding of where she's at. So input would be wonderful.
Okay, so we're opening the floor for questions and feedback from our learners. Please raise your hands and we'll give you the opportunity. Susie.
Thank you. And thank you, Samantha, for presenting. When I was reading the case, I wondered, does the spouse also have substance use issues? And are they currently living together? The case said that she had her own housing. So I wondered, what kind of consequences is she actually having right now? Certainly, she's not with her children. Is she also still with the spouse? And she has a lot of positives going on too, that are family supportive of her recovery. She has her own housing. I'm just kind of wondering if some of this is new or ongoing, and if there's some other influence from the spouse, perhaps.
So he actually has substance use issues. CPS requested that he start treatment and stuff because he was living in the house. She says he's not living there, but there's no proof behind it. And he hasn't followed through with any of the stipulations that CPS has given. He refuses a drug test. He refuses to sign up for treatment. And like I said, there's no evidence of whether he's living there. 1 minute he's there, 1 minute he's not. And I think that's why CPS wants her to go to first step, is because then she is removed from the situation.
Thank you.
Thank you, Samantha. Any other questions or comments? Richard.
Yes, I was real curious. When you say go to first step, is that a residential treatment setting? What's that look like, first step?
First step is a place for domestic violence victims, and they go, so the participant would go there. They would help her establish safe living. They would build back her relationship with her children. They would help her with counseling, treatment. Yes, she would be living there. And one of the reasons she didn't want to go to first step was because she did have her house. And she was worried that if she gave up her place to live, because she owed another apartment complex money, that she wouldn't be able to establish another house. Well, her CPS worker told her, first step will help you resolve that issue. They will help you get into a new apartment in a better location, and they would help you with all of this. You just have to volunteer to go.
Thank you, Samantha. Samantha, has she explained or has she mentioned what are her reasons not to want to join First Step besides the housing issue, is she
That
willing
is
to receive the help or no? What has she expressed? What has she said herself?
so really the only reason she has given me is that she don't want to lose her apartment. And I have, for a week, I've thought about how to approach her with the negativeness of the situation and how to show her the positive aspect of it, of going to First Step, without her thinking that I'm on CPS's side.
I see. Dr. Hernandez.
Thank you, Samantha, for the presentation, first and foremost, for all the work that you're doing on the ground and for the courage to present this type of case in front of this setting and other people. It's not an easy thing to do. So appreciate that from you a great deal. And for you to think out loud with us around this stuff. Clearly from your presentation, I have a question. How old are the kids?
So her kids, the youngest is 1, then she has a 7-year-old, I believe a 9-year-old and a 10-year-old.
Okay. And did all kids test positive for methamphetamine and cocaine, or one or two of them?
So one child tested positive for cocaine, and then her 1-year-old tested positive for the methamphetamines.
So thank you for that clarification. In terms of the stages of recovery that I just presented, would we agree that she's in pre-recovery, right? Not necessarily recovery initiation. She's in pre-recovery. Um, so, so a few things. Number one, you want to make sure that you cover harm reduction with her. If that would have been if that would have been fentanyl or any other these things that these kids can overdose on, we would have been having a very difficult and different conversation, right? And again, we're not about telling people to stop. They're going to stop whenever they're ready. But at the very least, we can keep some things that are safe around, right?
Right.
Then some safeguards around them and build safeguards. And then I'm going to the heart believe can be the huge motivator for her for initiating change, and that's her kids. Some people don't care about themselves because they've lived that life and they do care about themselves, but you know what I'm saying, right? They're so engaged in that life that it becomes very, I can deal with this and blah, blah, blah. I lived on the street before and went to prison and all that. And we behave that way. But when it comes to kids, it's a different conversation. And so you want to center the experience of the kids. You want to center the experience of kids being removed, where they're going to end up. When you're not talking about 1 or 2, 3 kids, I think you mentioned 4, those kids are then divided up. And within those systems, there's abuse, there's neglect as well. And so the reason why I mention those things out loud is not to scare anybody, that people know that that's the reality, but it's to motivate change. Because I would begin with her is talk to me about how you feel about your kids. And I'm sure she's going to say, I love them. I want this for them. And engage in that conversation, build all of that up. And then you want to use motivational interviewing where you develop some discrepancies, right? Those discrepancies are you're saying you want all of these things for your kids, and I believe you. But what do you think is going to happen to them within this system? Right? What do you think? I'm not going to tell people that. I'm going to ask them. She knows. That can motivate change in the other direction, right? That can motivate some seeds that you plant in there because clearly she's in pre-contemplation. And to move in that direction is that. The piece with her significant other, that's a very difficult one, right? And but the motivation to say, I want to do something about this is where you want to start with her. And for me, when working with people who have kids, especially young children who have been taken away by the system, it begins with that because they will do some things as it relates to that. Those are some of the things that I can offer. And above all, continue to have the relationship that you have with her, where she feels comfortable to tell you some things. In other words, sometimes we want to shake people because they're in very difficult place and they can't see past their current reality. And sometimes we want to use some choice words. Keep away from using those choice words because it will destroy the relationship. Then she's not going to have you at all.
Right.
And right now, she's speaking to you. And that is a huge start. That is a huge strength.
Yeah.
Thank you, Dr. Hernandez. Lindsay?
There you go. Sorry. I did want to mention too that, while it's, we definitely want to be truth tellers, right? At the same time, like, I think it can be really difficult sometimes for us to step back and realize that that's, somebody's choice is their choice. And if all we can do is let them know the consequences, and be upfront and real with them, and if that's the choice they choose, that's the choice they choose. And that can be really difficult, and then maybe making a plan if this happens, where do we go from here, right? If your kids are taken away, what now? What's next for you? And have that in place. So not only will that let her have the chance to, really think through the consequences, right? But also somewhere to go if what happen, if that ends up happening.
Thank you. And we have a comment here. Dr. Clancy says, maybe it's helpful to connect her with a community of moms that have experienced similar situations. They will hopefully share that it's much easier to keep your kids versus trying to get them back. How do we think? What do we think about that? Dr. Clancy, do you want to elaborate a little bit more on that?
No, thank you.
Any other question, comments, or Jennifer?
Question was, is this the first time that she's experienced CPS intervention? Because if so, it's possible that she doesn't believe that they'll take her away. My experience, pride and ego told me that nobody was going to do anything to me. However, I still got put in jail and did 6 months treatment. Maybe she doesn't really believe it's going to happen. Obviously, she's in denial from the abuse, which is typical for a woman that's been abused. So maybe just asking her more about the abuse if you haven't, and kind of motivational interviewing to get her to answer her own questions. Like, why doesn't she have value in herself enough to be honest and get out of that situation? Is he threatening her? Is he threatening the kids? Like, what else is involved? And if it is her first time, she may not just really believe that it'll happen, but it also, might be what she needs to finally get straight, whatever straight for her is going to look like. I just wondered.
So I think this is her first time of having them removed from her custody, but she's had previous cases where they've investigated and then found no probable cause. With the community that we live in, speaking from past experience, I've been in her situation, the exact situation, and they actually did file charges on me. And so I'm not sure if they're going to go through with charges on her or if she's going to face that or if they're just going to remove custody completely. But that was the eye opener to me, was the sitting in the jail, seeing that and realizing, okay, so this is real. This is what is happening. And I don't know how to make her see that. Like, I don't want to sound like I'm on the side of CPS, but you're fixing to lose your children, and it's, how do I motivate her to see that?
Dr. Hernandez, do you want to say something? In a way, kind of relating what Samantha's saying and what you said about asking the right questions and motivational interviewing, maybe.
Yeah, there's the chat is alive with people recommending MI, motivational interviewing, right? Again, the oars in motivational interviewing help us to not criticize people directly or to tell people this is what's going to happen to you. That doesn't work. People get upset at that. Or you're going to end up in prison, in the hospital, or in the cemetery. Well, so what? Don't tell me that. I already know that, right? It has to be a conversation with, and that's why I begin with what is it that you want for your kids? Because that's aspirational, that's goals, that's what I want. What is it that you want for your life? Pa, 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 pa.